Representative Akland, thanks for joining us.
Thank you.
So let's just start here kind of with the basics. Tell us a little bit about yourself and why you decided to get into politics.
So I had never been in politics before. I'd never run for any office. My first career was as a registered nurse. I worked for 45 years in nursing. And I retired to stay home to take care of our parents who were living with us at the time on hospice. And once both of our parents passed away, I had time, and I was getting more and more discouraged with some of the direction the country was taking. I felt that we had a very divided country, and I saw myself as somebody who could make a difference. And a friend had said to me, "Susie, I think you should run for office," because I'd been voicing some opinions. And it's like, you know what? I have the time, I have the energy. I think this is the right thing for me at this time in my life.
And you come to us from St. Peter.
I do.
What type of community is that, and what kind of issues are important to your constituents?
So St. Peter is purple. So it's very evenly divided politically. And so that has been a challenge for me. But perhaps I'm the best person for that challenge, because I see myself as someone who is a good listener, somebody who can see both sides of an issue and try to come to some agreeable conclusion in many areas. It's not always possible, but at least I try.
And this is your first legislative session as a member of the House.
It is.
For the most part, it's been remote. What has that experience been like for you, and how much do you miss interacting with your fellow lawmakers?
So, two things. One, because I hadn't experienced the in-person committee meetings and in-person legislation, I don't know what I was missing. What I did know that I was missing, though, is that as a freshman legislator, I spent my full time in my office. Even though we were on Zoom, I was in the state office building. But there were people around for me to ask questions of. And in fact, even our assistants weren't in the building. And so there were just some logistical things that I had to figure out for myself. And it's been more difficult. I think the learning has been slower, because I don't have that natural chatter that comes with discussing a bill or discussing legislation of some sort. And so I felt like I was very much alone much of the time, and that I had to learn on my own way more than was comfortable for me sometimes.
And you've worked in healthcare as a nurse.
Yes.
I believe I read off your campaign page that your husband, a physician?
He is, yes.
So considering the world we live in today, how does your background in healthcare help you in your role as a state lawmaker?
I think it helps me a lot in this sense that your training as a nurse teaches you to think critically. Perhaps the most important thing, it teaches that you have to listen. You can't make assumptions. You need to get the full story. You need to get the whole history from a person to know how to make a decision. So daily we were faced with the challenge of listening, evaluating, using some critical thinking to come to some sort of a plan, and then critical thinking on how to implement that plan best for that person. So I think those skills apply to so much of life, and especially as you're studying legislation. You need to be able to see the big picture and then make a decision.
And along with the 2 House Health Committee assignments that you have, you also serve on the Environment and Natural Resources Committee. What are some important areas that you'd like to see addressed in 2022?
I came into the Health Committee hoping to make a difference in the cost of health care. What I didn't realize is the Health Committee is more about policy. That the cost of health care sort of falls under another committee's venue. So I haven't been able to address that, but I was able to, affect some policy within the Health Committee that I think will be good going forward. The big picture right now, I think for everyone, is the $7.7 billion surplus that Minnesota has. That's good. It's good that we have that money. We need to figure out how to use that money that will benefit Minnesotans. My thought on that is we need to make Minnesota a tax-friendly state. And I would be very much for filling or repaying the uninsurance bucket first and helping our businesses and not creating an additional tax on them. That would be very important to me. Secondly, I think that the money is taxpayer money, and I'd be in favor of returning that money, possibly in the form of a tax refund.
And just finally, I wanted to ask you, when I was looking at your campaign page, bold lettering, first thing I saw. Stand up, speak up.
Yes.
Why did you choose that slogan?
Because I stood in front of the TV that evening watching Congress, and there were things coming down. There were bills being passed or legislation being introduced, and sometimes I would say to myself, when I think it can't get any worse, it gets worse. And then I would see this whole divisiveness. And that night I stood there. I had 10 people in the kitchen with me. We were having a little study and watching this news, and I said, somebody has to stand up. Somebody has to speak up. And those were my exact words, and a friend said to me, Susie, I think you should run for office. And so that became my campaign slogan, that, you know what, we as citizens need to stand up. We need to speak up. So that has become my slogan.